Technology is driving an investment in the last few months of life rather than the quality of the overall life. And you know, seeing what's occurring in the US and hearing discussions about the US and some of the leadership around health in Australia, it's pretty clear to me that if we continue down the same road, things will not get better. The wind is changing towards moving away from empiric data and economic-driven healthcare to person-centred healthcare, to the really meaningful life outcomes. Thank goodness we're beginning to move away from measurements of healthcare delivery that are based around how quickly someone moves through an emergency department or encounters an outpatient service to an actually meaningful outcome. What I've seen, whilst I'm trying to lead a general medicine service that's suffering under those economic rules, I've been trying to build and nurture a refugee service with nothing. No resources, really, to start and to speak of when to start. No specialist colleges, no oversight and supervision and curriculum, etc. We just built this service around the needs that were presented to us organically from the ground up. And we've been noticed. We are noticed. Believe me. The hospital systems are looking and saying, well, hang on a minute. How come you're starting to make you're actually beginning to make a dent in some of the issues in the lives of new Australians with no money, with no colleges, with no supervisions, curriculums in a significant NH and MRC and ARC type research projects. We've done it because of goodwill, great people seeing a need and just working on it, just self-assembling around that need. And we're 2 days of presentations that describe that eloquently. We are the new disruptive innovation in healthcare. Do not lose sight of it. Do not feel marginalised. Do not feel demoralised. We are the new model of healthcare that's coming. It's clearly economically effective because it's been bugger all investment and we're already delivering outcomes. Keep going. Just keep going. Clayton Christensen talks about, and I had a chat with him a couple of years ago at Harvard. He was really the author and father of the term disruptive innovation. I don't know if you know what it means, but it's a term from the corporate and economic world that says, you know, and it was used to describe the sudden uprise of laptops in the face of the Fujitsus and Honeywells, and I won't go on about it, but what it is a small initiative that begins in an entirely different model, an entirely different market. It's not a new idea, it's an idea that comes from left field and over time completely disrupts the status quo. And it has to come from left field in a different market. So it has to come from a place that isn't heavily invested with all sorts of silos and all sorts of political issues. It just gradually, organically develops. Began in the garages in Silicon Valley and led to the Apple shop, which I see people queuing for 3 hours this morning down there at 6:30 for a first meal arcade mini. And it just toppled everybody. Refugee health, we are being enviously looked at from the economic rationalists, trying to work out why on earth we can get these services assembled so quickly, so efficiently, that tie together the wicked issues of hospital-based tertiary care, primary care, Medicare locals, NGOs and various other organisations that they've been backing for years to try and get to play ball around diabetes and various other healthcare models with beginning to get some success, but marginal success compared to the timeframes that we've had. My message is we are on the right boat. We are the future of healthcare that is patient-centred, that is really based on health outcomes and can be delivered very effectively by well-meaning people. Thank you.
Any comments from the panel?
Well done, mate. Just had to do that.
Any comments from the people about what's been discussed? Because that's